Let's have a short discussion on modifiers TC and 26 in radiology coding. Did you know? In addition to radiology coding, modifiers 26 and TC are used for path and lab coding. But today, we're only going to focus on radiology coding. And just so you know, modifier 26 is also known as the professional component of a code. Yes, so we append modifier 26 when we only want a code for the professional. NTC is used when we only want a code for the technical services of a code, of a radiology code. Now I'm going to show you. All right, so look at code 71045. This is a radiology code. This is a chest x-ray, and it is considered a global code. Yes, in fact, all of the radiology codes are global codes because it's understood that there are many items bundled into this code. In addition to the service, the radiology service, the use of the radiologic equipment is bundled. So too is the services for the radiology technician carrying out that scan. The supplies are bundled. The room and facility, that radiology room in the hospital, even if it's in the radiology department. The equipment maintenance and depreciation is included. The clerical support, front desk, the supervision of the procedure, the interpretation of the images, the documentation and report by the radiologist, and the medical decision making that went into that decision or that diagnosis. All are bundled in this code. So, again, this is a global code. Now, let's go ahead and break it down a little further. All right, so we have our chest x ray, and in general, it bundles these items. I just kind of classified them. All right, so you don't have to be so specific. All right, so it bundles the professional, the equipment, the supplies, and the technician. And the hospital will use or bill this code 71045. But what if the hospital does not employ that professional, that radiologist? How does that radiologist get paid? Well, when that radiologist is not employed by the hospital and they work for a radiology group, coders, you know that has to be something you can resonate with. If you've ever gone to the hospital, whether it's the ED or you were inpatient, you're going to 9 times out of 10 get a separate bill from the radiology group or the radiologist because they're often not employed by the hospital and they have to get paid. So, how do they get paid? When they provide the professional services for that chest x ray? Well, they bill that code 71045 and they append the 26 modifier for the professional component of that code. So it broke out just the professional piece of that code, and that's how it's done. Are you with me? I can't hear you, but I can feel your energy. All right, now let's talk about the technical component. Oh, by the way, too, when we append this 26 modifier, it will reduce the payment. We'll talk about that at the end. All right. Now, what if we have to code only for the technical component? Let's say the an X-ray company provides the X-ray equipment to the hospital. Let's say the hospital doesn't own the X-ray equipment. Well, that X-ray company, that X-ray equipment company is going to have to get paid, and they're going to do this. They're going to append TC modifier at the end of that chest X-ray. And that also reduces the payment. It reduces the payment because remember, the global code includes a lot of stuff. And speaking of that global code, well, who gets to bill that global code? Well, the hospital does. Yeah, the hospital gets to bill the full code. Yeah, and we'll talk a little more about that very soon. But I do want to show you what those payments look like. Well, I went to my friends over at Find a Code and I went ahead and put code 71045 in the calculator, and this is what we get. So when the hospital bills or anyone qualified to bill this code 71045, they will get $25.23. However, when the professional bills the code for their professional services, they will get $8.41. Now, the technical component, TC, they will get $16.82 for usage of that equipment. Now, some of you might say, well, wait a minute. How does the hospital get to bill for this 71045 and still get the full amount? They're they're not they don't own the equipment. They're not employing the radiologist, and no matter what, the hospital always gets to code for 71045. Well, and they're not double dipping, and I'm going to show you. Well, the hospital's actually billing for the facility. They're not billing for any professional services, and they use that code. So this is their claim form, a hospital billing form. It's called a UB04. And how they bill is they use these revenue codes that further specify exactly what they're doing. So it's 0324. This is the chest x-ray. And then you have to put in the code. This is where it goes, their HCPCS code. And remember, CPT codes are also HCPCS level 1 codes. And there's the bill. But unfortunately, they're only going to get $25 for it, but that's how they bill. So technically, they're billing for different things, but they are also um, billing for the facility and they get reimbursed a little differently. But the thing is, what you need to understand is that you have to be able to identify who gets what part of that global code. You know the hospital gets what they get. They get the they get to bill the full code. You know the professional who only provides the professional service will bill with the 26 modifier. And you know the technical providers who provide the technical services and equipment will build TC. And that is it. Now, coders, it's time for you to apply what we've just discussed to practice. All right. So we have Amy arrives to the ED with a continuous cough producing green mucus. The physician wanted to rule out pneumonia. So she ordered an AP lat of the chest carried out in the X-ray department. A radiologist from ABC Radiology Group interpreted the results. Code for the radiologist. All right. So if we are coding for the radiologist, and if we use this little rule sheet, the radiologist is the professional, right? And if the radiologist is the professional, it says physicians have to use modifier 26. So we would append modifier 26 to 71046. Yes, 46. AP lat is 2 views. All right. Did you get it? Let's see how this one goes. Amy's at the ED with a continuous cough producing green mucus. The physician wanted to rule out pneumonia. She ordered an AP lat of the chest carried out in the X-ray department. A radiologist from ABC Radiology Group interpreted the results. Code for the hospital. All right, that is our task. Code for the hospital. And coders, as a side note, this is the reason why we read the last question first. So you know what the task is. There's a lot of words there sometimes in that documentation, and sometimes we can get caught up. So that we're focused, we tell you to read it first. And we need to code for that hospital. All right. So I'm going to just kind of visit the rules. And the rules say that hospitals have no modifier, right? So if hospitals have no modifier, our code is 71046. I'm going to let that marinate. I hope it makes sense. Okay, we've got one more. All right. So the X-ray equipment is owned by DEF Imaging, code for deaf imaging, right? So look at this code for deaf imaging. Right away, we knew what to do. And also, I want to tell you, there's a lot of instructors out there who are telling you to just kind of skim, read the last question, and then do the answers. Don't you dare. An AMCI student better read all of that documentation. And you know how we do things at AMCI. We like charts. For those of you that really resonate with seeing it, hopefully this helps. Let me know if this chart helps. All right. So I know I didn't discuss everything, but hopefully this chart does it. If you are billing for a facility, you don't need a modifier. If you are billing for the radiologist or the professional rendering the service, rendering the professional component of that radiology service, 26 modifier. If you are billing for the equipment, the technical equipment, TC modifier. If you are billing for an imaging center and that imaging center owns that equipment and interprets that report, you build no modifier. You build the global code. If the physician owns the equipment and interprets that report, no modifier. You get to build the full code. And finally, if the physician owns the equipment and they carry out the radiologic service, but they don't interpret it, TC modifier. In some coders, you're going to need both TC and 26 modifier components to build the global code. Now we got a gem. All right, here is the gem. The physicians or the professionals use modifier 26, technical providers or the companies, they use modifier TC. Hospitals have no modifiers. If the physician owns the equipment and reads the report, no modifier. And you must have both components to build the global code or to use that code. All right, hopefully that helps. All right, this concludes our discussion on modifiers TC and 26 for radiology coding.